Hi, it's Dr. Burmeister with Bellin Health Emergency Services, here to talk to you today about COVID-19 vaccination and reviewing the benefits of COVID-19 vaccination, as well as some of the rumors and risks that are out there. You know, it's probably not a surprise to anyone at this point that COVID has had a tremendous and significant impact upon all of our lives across the entire globe since, really March of 2020, when we saw our first cases start to appear around that time here in the United States. Here in Wisconsin, we've seen 7,000 individuals who have been confirmed to die from COVID-19. And there's some probable cases that are out there as well that either were not able to be proven or we're awaiting more data to confirm those. And this compares to influenza, where on an average influenza season in Wisconsin, we might see a couple of hundred people who unfortunately succumb to an influenza infection. So that's a couple hundred compared to 7,000 with COVID-19. And this is really on top of really aggressive mitigation and prevention efforts we had as a community to even prevent the spread of COVID-19. As everyone probably knows, we really had significant restrictions on visitations to nursing home and assisted living facilities. Many businesses were completely closed. Cruise ships were closed down. People didn't travel anywhere. They didn't go see their family and friends. Schools were closed. So we took really aggressive strategies to prevent COVID-19 infections in our community. And despite this, we still had over 7,000 people who had passed away from COVID-19. We now have a key prevention strategy, and that's vaccination with one of our three currently authorized vaccines by the FDA, which have emergency use authorization. So the benefit of vaccination is clear at this point. Not only does it have a significant benefit of helping you from getting COVID-19 in the first place, but in the rare chance that you're one of those breakthrough cases, we still have people who, might get COVID despite being vaccinated. And we know that vaccination also helps people be less likely to get sick enough that they require hospitalization. And also it helps prevent people from dying from COVID-19. So really significant benefits to vaccination all the way around. There's likely people out there who are young, otherwise healthy, and don't have high-risk pre-existing conditions who might be asking themselves, why should I get vaccination when the chances that this really impacts me is, really minuscule? We do note that there are some children and young people who have had really bad COVID-19 infections, but it's still important as a public health strategy to have young people vaccinated. First, because it helps prevent you from passing it to a loved one, someone at work, or someone else in your community who might not be as lucky to still be young, healthy, and not vulnerable. And number two is we see a lot of variants coming out at this point. As viruses spread, we expect that they'll have mutations in them, and some of those mutations might make the virus a little bit stronger. Some might actually make them a little bit weaker as well. But the way that we prevent new mutations from developing that could make COVID-19 even worse than it has been on our lives is by preventing anyone from getting infected, because mutations come about when they infect new people, and that virus replicates and makes essentially new viruses and spreads from person to person. So two benefits, even if you're young and healthy, to being vaccinated is, number one, you protect your entire community, and number two, you are not a host to the virus that could make it become a new variant. There's also, of course, economic benefits to vaccination. We've seen some of our favorite restaurants and other businesses close during the pandemic. We've had kids out of school to help prevent COVID-19 from spreading. And if we can keep case numbers low, not only do we help protect our businesses and all those people out there, but we also can help get our kids back in school and keep them in school with as little impact as possible. And also, if tourism is a big, important part of your business or your community, consumer confidence really is key to ensuring that people will continue to come visit your area. So vaccination and good vaccination rates can help bolster those numbers as well. Certainly, I'm compassionate and understand that getting vaccinated can be sort of scary, especially when something seems to be relatively new. We know that the mRNA technology, though, has been used mostly for investigational purpose for well over a decade. Having this degree of vaccination, can be scary to people, particularly with social media and rumors that are out there about people who have had vaccination impact their lives. Now, when I think about people I know and patients that I have seen who have been impacted by the COVID virus, there is really a lot of people out there who I know who have been impacted by COVID. When I take a look back with the millions of people across Wisconsin and the United States who have been vaccinated, and I think about who do I know who has had a significant adverse event from the vaccine, it's a zero. I actually don't know anyone and haven't seen any patients who have had a real serious adverse event from vaccination. So we have that sort of what we call anecdotal evidence. But also we've had millions of people, including myself and almost all of the healthcare professionals I know, who have helped contribute to understanding vaccine safety by filling out what's called the vSafe app. When you get vaccinated, the CDC and the FDA have an application where they send you a text message every day after you've been vaccinated to check in on what side effects you're experiencing. And then every couple of weeks and couple of months after vaccination to see if you've had any new medical conditions that have come about. And there have been millions of people who have participated in this, and the vaccine continues to be proven to be very safe. Of course, there are some cases that have been presented of myocarditis from some vaccines, particularly in young people. Those cases have been relatively mild. And there's some other cases out there that, of course, are being actively investigated. But just remember that, tens to hundreds of millions of people have been vaccinated at this point, and the vaccine is extraordinarily safe. And right now we are enjoying, the environment that we currently have with a very low case count. A lot of our businesses are open. Our kids have been back to school. And if you're vaccinated, you don't have to wear a mask anymore. And despite, essentially having normal lives at this point, we continue to see extraordinarily low case numbers in our community and low number of hospitalizations. And this is all thanks to the vaccination strategies that we've had so far, with more than 60% of people who are eligible for vaccination in Wisconsin having achieved it so far. So I hope this video gave you a little bit of insight into why I chose to get vaccinated back in December and January of this year, and why I encourage all of my family and friends and patients to get vaccinated as well. If you have any questions about vaccination, you can always reach out to your healthcare provider or reach out to us, and we're happy to try to answer those questions for you. As we continue this strategy, we're going to have vaccination more and more readily available at clinics across your community. And hopefully that access is really easy to get to, so that you can get vaccinated too, to be your part in helping us all recover, both from a health perspective and also from an economical perspective as well, from this COVID-19 disaster that we really have been experiencing for the last year. Thank you so much for listening. Have a great day.